A popular cosmetic medical procedure that erases wrinkles is getting a thumbs up from the government.
Botox was FDA approved in 1989 for use in neurology and use in ophthalmology. And as a physician, we have the ability to use what we call an off-label use, where we take something that is FDA approved and we use it for another use that we believe is safe and effective. And it had been used in Europe in the early 80s. So I had trained in Europe, and I also trained with somebody in British Columbia that did use this technique. First, we're going to clean the area with a little bit of alcohol.
And does she have to be sitting straight up when you do this?
Well, she can be leaning slightly back. One of the important things is that we don't want the patient to lie flat, because if you lie flat, you can affect the Botox. So we don't want the Botox to move to other muscles of the face. So we instruct our patients to stay straight up for about 4 hours. We don't want them lying down. Now, there are many misconceptions about Botox. Some people think you can't fly, or you can't lean forward, or you can't try on shoes, but that's not really true. You just can't lie totally flat. So we tell our patients, don't plan to have your hair washed or have a massage right after the procedure. Just wait 4 hours till the Botox sets in the muscle.
All right, we'll let you start the process here.
So what I'm doing now is I'm starting to the injections, and she'll feel a tiny pinprick. And we actually do a series of injections. The Botox is a purified protein.
So it's bleeding a little.
A little bit. There's tiny oozing.
I had to tell you, that looks like it's painful to me. Doesn't hurt at all, Judy? Which I guess Judy can't talk.
Not at all.
No, Judy can talk. Does it hurt, Judy?
No, it doesn't.
We paid her a lot of money for that comment.
I have a very high tolerance for pain.
So does it feel like a bee sting? What does it feel like?
No, just a little pinch.
A little bit of a pinch. It's really, you know, we use a very fine needle. The needle is the size of a hair. It's a very, very fine needle, and it's just a slight bit of solution that is injected into each area. So most patients say that it's very comfortable, and especially after they see the results the first time, they're very encouraged.
The only thing that's discouraging to a lot of people, I think, that would like to try this now that they're waiting this FDA approval is it's so darn expensive. Do you expect the prices to come down as more companies are introducing similar products?
Botox? Well, you know, it's interesting. Right now, Allergan is the main company that makes Botox, and they have worldwide distribution rights. And the cost of Botox over the 10 years has gone up to me in my practice, but with our patients, we've kept the prices the same. The interesting thing is you can get what I call bargain Botox, where it's less expensive, but I think your viewers should be concerned about that, because oftentimes the Botox is diluted. So it's a very dilute solution, and there are more complications with a more dilute solution. Also, it doesn't last as long. It can drift into other muscles and cause complications. As you know, any doctor in the United States can buy Botox, so you want to make certain that you go to a physician that uses Botox often, that knows the muscles of facial expression, that understands facial anatomy, has a lot of experience mixing Botox as well as using Botox.
In New York, Dr. Debra Jaliman has been offering Botox treatments for more than 10 years. She treats the area between the eyebrows, the forehead, the crow's feet area, and even the lines around the mouth.
So let me have you smile, Joyce, and you can see this is where your lines are forming. So what we want to do is we want to put our Botox everywhere we see the lines forming. And it's not that we're treating the lines, we're actually treating the muscle underlying the skin. I think with the approval of the FDA, it's really a gold stamp to say, you know what, if this is safe enough for the FDA, it's safe enough for me. So many people who may have been cautious